that if you have questions during the training, you can type them in on the chat feature. And then after the training, we'll be answering your questions just to kind of keep the flow of the conversation going. So again, thank you so much for spending this time with us and for being willing to take on a leadership role. You know, 2.5 years ago when I started at the foundation, we had 63,000 advocates that we communicated with. And today, because of the overwhelming response from our patient community, we have almost 150,000 advocates that we communicate with routinely. And so we're a loud voice, and we want to make sure that you have the training and the resources that you need to affect these access to care challenges. So here's just a little look at my team. And the bottom row you can see is made up of the state-based folks that you will be interacting with. But the folks on the top line are also on the advocacy team. Anna Hyde is the senior director, and she handles our federal relations and also manages the field staff. Mark Guyman is responsible for developing coalitions so that we're aligned with other chronic disease organizations in our policies and model legislation, and also just for developing strategy and helping to evaluate legislation. Laura Keeble is primary on our grassroots, our ambassador program, and our Platinum Ambassador program, and she manages that work and hosts webinars every other month for ambassadors and for advocates on policy issues of interest. And those are taped, so you can go on the web and see those. Kayla is Amadeo is our legislative research manager, and she's responsible for getting us data so that when we make arguments about issues like step therapy, we can actually show how many steps our patient population has to go through, what their experience is with how many drugs they have to try. And Julie Eller is our administrative coordinator, and she keeps us all on track and is our newest team member. Here's a visual of what the assignments of the state advocacy leadership team look like, so that you can take a look and you can see based on the chart down below who is your person. And they really are, you know, your right hand in terms of all of the advocacy work that you're doing and are available to you to help in any way. So I'm going to stop there. Oh, I'm not going to stop there. We changed this, excuse me. So what we really want to talk about today is how this whole process works in terms of the relationships that exist in the field, because there seems to be some confusion. So your advocacy resource person or your advocacy leadership team member works really closely with the field staff and the advocacy chairs. And while there'll be some similarities to all of the work that every state does, there will be some things that might be unique to your state. There might be some states in which we currently don't have any members of the Arthritis Caucus, and so the charge for that advocacy chair and those volunteers will be to try and recruit members for the caucus, or try to recruit a Platinum Ambassador since we don't have any Platinum Ambassadors in that state, or you want to increase the number of Platinum Ambassadors. So the work plans will really be very specific to your particular state and what it is you want to accomplish both on the federal and state level. So likely most states will be trying to meet with their health committee chairs and introducing the facts about arthritis. And there'll be other tasks like that that you will have to choose from to develop your work plan and your goals for the year. So we really want to make this as organized and offer you a menu, and then you can see in concert with your CED, your ED, and your advocacy staff person, what's the right work plan for your committee. Next slide. So now I'm going to turn it over to Pam Fields, who is a member of the advocacy leadership team. in the field, and Pam actually is the author of much of this training, and thanks, Pam, for all your good work.
And we'll answer many of your questions. We developed the webinar together at the request of both staff and LLB advocacy chairs, and in an effort to define the staff roles and the advocate leaders roles. We've put together the following goals for the webinar. We want to see how market relationships work together and how they interact with local leadership boards, how you interact with your local leadership boards when you get into a meeting. We want to look at preparing for state committee meetings, what you want to do to get ready with your CED. And we want to look at the state advocacy committee protocols. And the advocacy website and resources that are available to you. When you can't maybe get hold of somebody immediately, you can always check the website and see if your resources are there. The other thing I just wanted to tell you, two things. One is that the webinar is a pilot, and we're going to be recording it. If you know someone who's not able to be on and they might want to listen to it, please feel free to share it. We'll send that link out to you. And we are doing the webinars separately, one for staff and one for the LLB chairs. That was requested, and so we wanted to honor that request. After the webinar, there will be tomorrow a survey sent out. It's only 5 questions. It'll take about 2 minutes, and we appreciate if you would get that back to us so we can evaluate and improve the webinar. Now, I'm happy to introduce you to Ben.
Thanks, Pam. This section outlines how you can integrate the committee's work into your local leadership board meetings. Each board meeting should have an advocacy report given by the advocacy chair, and this report should include primarily top-line accomplishments or victories, the status of any pending state legislation, an update on national goals like the number of new advocates and ambassadors, as well as federal legislative updates. You should also include dates and details for any upcoming advocacy events like state capitol days or trainings. And I would finish with action items such as contacting your state or federal elected officials in advance of a hearing or a vote or what is going on in your specific market. Board meetings and advocacy committees should be operating on a two-way street as well, with board meetings informing those committee activities. For example, you may need staffing at the advocacy booth at a walk, or the need for recruitment of advocates at events, or as Sandy mentioned, the need for platinum ambassadors. I'd also like to help guide advocacy committee members in preparation for a state advocacy committee meeting. I would make sure before the meeting to review all materials from the last one to ensure that to-do tasks were accomplished and the goals were met or in progress. You should check the status of all state legislation using your state legislative website or the Foundation's state legislative map, and you can find that at arthritis.org/advocate. If you need help on this, you can always contact your state advocacy director, who'll be more than happy to assist you. These first 2 tasks should inform the next steps for the committee. So that could be possible questions for other committee members or possible questions for staff as well. It should also help you think about the committee's goals for 2017 and the progress being made. Additionally, minutes should be taken by an assigned committee member or the CED and then be sent to the alt member. And we can help you provide a format for those minutes. Next, Anna will take you through the committee protocols and expectations.
Oh, sorry. Hi, everyone. I am Anna Hyde, Senior Director of Advocacy and Access for the Arthritis Foundation based here in DC. And I'm just going to go through some of the protocols that we've put together over the last year for the state advocacy committees. This was one of the charges that we took on when we unified as an organization. We know that there are advocacy committees that have functioned at a very high level for a very long time. But there are also states that haven't had an advocacy committee at all before. So what we've tried to do is create some guidance documents to help any committee, whether you are fully functioning or just getting started, to sort of see how we envision the committees being conducted in the future. And also to talk a little bit more about 2017 in particular. I feel like last year was just kind of building the infrastructure around these documents, and now really putting them into practice. And that's really what this training is about, or at least this part of the training. So the big questions that have bubbled up from the field that we hear consistently are, what are the state advocacy committees expected to do, and are there specific 2017 goals for the committees? So we're just going to take those one by one here. So what we've talked about as a staff is that for each state advocacy committee, there is a basic set of expectations, and we've listed them here. We think that at a minimum, everyone on the committee should be an advocate so that you're getting the news and the action alerts and really up to date on all of the things that we're doing with advocacy. Responding to action alerts and informing your community about the alerts is another sort of basic expectation. We try to keep action alerts to a minimum because we don't want to give action alert fatigue. So at least on federal issues, we do a handful a year, and then certainly if you're in a state that's very active legislatively, you get some there as well. But responding to an action alert really just takes a couple of minutes out of your time, and we try to give you as many tools as possible to make it really easy and quick. Recruiting new advocates and ambassadors through your network is definitely one of the base expectations. We certainly want to continue to grow our advocate numbers and increase the number of ambassadors as well. And then one thing that's relatively new, you may have heard that in election years, so this will start next year, we are not going to be doing a full summit, but rather we are going to be doing a fly-in just for our platinum ambassadors. And so we certainly want to focus on elevating our ambassadors and advocates to that platinum status. And platinum ambassador, how you achieve that is by joining the ambassador program and completing all of the monthly assignments, and then 4 additional bonus assignments. So ensuring that your state is represented at the first ever Platinum Ambassador is definitely a priority. And so you'll be able to work with your advocacy team member and others to get a sense of how many, if there are any, Platinum Ambassadors in your state already. And if not, then that'll be a big goal for 2017 to recruit someone to Platinum Ambassador status. Beyond the basics. So of course, as we were talking about these basic expectations, we sort of thought this is just a floor for how we think that the advocacy committees and the committee members should function. But obviously, that's just the beginning for many of you. For those of you who are just getting started and just starting to build committees, that's maybe enough for 2017. We certainly don't want to overwhelm you. But for those of you who have established committees and you really want to take on more, we've put together a menu of options for you. So we want these committees to function as much as possible organically based on the needs of the state. So you may be in a state that's very active legislatively this year, and there are going to be a lot of state action items that your committee needs to consider. You may be in a state, however, that doesn't have any active legislation, and then you might want to focus more on building relationships on the federal side, because of course we do have a lot of active issues going on right now in Congress directly in our space. So this is really a good year to focus more on federal for those of you who are in states that may not be as active there. So the additional goals should be determined by each committee based on whatever those needs are and what's going on in your state. I won't go through each of these. You can sort of read the slide, but I do want to spend a couple of minutes just going over the documents that we've put together. We, of course, there is the advocacy chair description, which I believe you all have, and it talks about, your responsibilities as a leadership board advocacy chair and what that means in terms of, recruiting and training advocates and monitoring some of the issues that are going on in your state that maybe need to bubble up to our, our agenda, and then just generally serving as a voice of the arthritis patient. One question that we have received is the financial support requirement of $1,000 give-get. Do you have to double that if you're trying to get to that Platinum Ambassador status? And the answer to that is no. That once you reach that $1,000 threshold, that is good for both your leadership chair requirement and also platinum ambassador requirement. So I just wanted to get that out of the way. A couple of the other documents that we put together for just the committees in general talk about a member description. So what is it that we're looking for from an advocacy committee member, not necessarily the chairs, but just your rank and file committee members. So this should help as you're recruiting new committee members, ensuring that you're choosing people who really can complete these responsibilities and who are, enthusiastic to take them on. And then another document we put together goes into some of the action items that the committees can take on. It's just a menu that you can use as a guidepost, but certainly, there aren't requirements in there. They're just things that you can choose based on, again, the needs of your state. Okay, so getting a little bit more into the nitty-gritty, we've put together a document of protocols that's meant mainly for internal staff, because we do have so many shared responsibilities between the advocacy team and the CEDs and the EDs. So it helps to kind of level set everybody. We thought it would be helpful for the leadership board chairs to see these as well. And there are some frequently asked questions in here, and I'm going to go through just a handful of them because a lot of these are questions that have bubbled up from you all. So one is there a size requirement for the advocacy committee? And the answer is no, not in particular. It should be proportional to the size of the state and the advocate population in your state, but a good target number would be about 8. Another important question, will there be online orientation available for the state advocacy committees? The answer is yes. We plan on doing a general training webinar that can be archived similar to what we're doing right now and used as needed. And we also have made ourselves available to do trainings over the phone or in person as, to the extent that that's possible for your committees or leadership boards. We've done that a number of times in the past year and are always happy to do it. Next question, can there be market advocacy committees in addition to a state advocacy committee? The answer to this is no. The market advocacy committee should be phased out, and the relevant advocacy leadership team member and field staff should work together to integrate market advocacy committee members into the state advocacy committee or other volunteer roles. So there should be one advocacy committee per state. And if you have a number of markets in which you've had advocacy committees and you have maybe too many people for a state advocacy committee, then that's where we would have a conversation about how we could sort of integrate those folks into other roles. The next question is there a difference between the state advocacy chair description and the local leadership board advocacy chair description? The answer is yes. Even though in most cases the LLB advocacy chair and the state advocacy committee chair are the same people, the responsibilities are different. So the chair description for the local leadership board defines the responsibilities to the board, which would of course include updating them on the advocacy committee activities and other important advocacy items that might be relevant to the board. But for the state advocacy committees, it's really more, chairing the committee and providing a leadership role to the committee and getting into the nitty-gritty of the advocacy work that we do. So the next question, in states with only one local leadership board, can the advocacy chair be a different person than the state advocacy chair? The answer, in theory, no. They should be the same person, but there may be exceptions. And we've already had a couple, and we can review those on a case-by-case basis. We want to be flexible and do what is going to be best for you and your committee. We know that over the last year, because of all of the changes that have happened, this type of scenario has come up and may continue to come up over the next year. But what we're really doing is trying to put together a plan to phase out those types of scenarios so that going forward, the chairs that are chosen are able to fulfill both roles. And the last question I'll go over before I then turn it over to Claudia to talk about our online resources is, in these early stages, what do you do if the person who is the leadership board advocacy chair doesn't want to be the state advocacy chair? We have experienced this as well, and really the answer is almost the same as what I just said, that we should work towards phasing out that sort of scenario so that person can cycle off as the leadership board chair and transition to being just a rank and file member of both the board and the advocacy committee, if that makes sense for your particular situation. So I will stop there. And if you have any further questions about anything I talked about, please just enter them into the chat function and we'd be happy to go over them at the end of the training. And with that, Claudia.
Thank you, Anna. Hi, everyone. So we look at the advocacy resources that we have on our internet through our web link and through the arthritis.org. But first of all, we have a new piece that's available through the toolkit. And we just actually introduced it at the National Advocacy Summit on a federal level for U.S. Congress, but this is another item that's focused on the state legislators' introduction to arthritis. So basically what this is, to give you an example of how it can be used, is if there are visits with your legislators in the state, through one-on-one, or if you are talking with a legislator at any point, not necessarily at the Capitol, this is a nice tool that will give them some basic information about the Arthritis Foundation and what we're involved in. You have a letter inside from Ann Palmer, our CEO, and that talks about the need and for the legislator to get involved in what the arthritis is doing and what we're about, and asking them to support their constituents who are living with this chronic disease. It also has a great U.S. map included, which shows state by state the prevalence of arthritis, the percentages in each state. And then it also lists all of the position statements that the Arthritis Foundation has on various topics that are considered on a state level, where we're trying to get laws passed. For instance, biosimilars, step therapy, prior authorization, to just give a few examples. But all the position statements are right there for the legislator to refer to and where we stand. And then lastly, it shows the many resources that we do have for people living with arthritis, and the many tools, and all of these it shows available again on the website. And it also links to the tools that we have for legislative involvement. So that's a new item, and it's a great resource, and it's available through your advocacy team leader in the state, and it can be customized to put the legislator's name on it and as a leave behind. So it's a great new piece. And then when we go to the actual internet and to our website, I will outline the sources that are available. So on the tab at the top, Fighting for You, you click on that, click on Advocacy, and then you're going to see a wealth of information. So let's highlight some of the things that are available. So first of all, signing up to be an advocate is always a key ask. So we encourage you to do that if you have not done so already. But it's very easy to do right here. Then you go to the Advocate Tools and Resources and what's available, the Advocacy Toolkit, everything that you'd want to know about how to write Congress, how to attend a town hall, etc. And it's all available there. And when you have time, I know there's a lot of information to sink in right now, but when you have time to go through here and just play around, and you'll see what's available. Then you have, of course, the ambassador program. You have the policy priorities. And for instance, if you look in the research and prevention, this is where you will find, and this is just an example, but how we're involved in the research that's going on for our veterans and our support of the military with the high incidence of arthritis. And this will give you lots of information of many statistics and how we're involved. Go to Awareness tab, and there you will find joining the Arthritis Caucus. And again, talking to legislators on U.S. legislators, but this is always a continuing mission of ours, is to get more and more of the legislators involved and to join the caucus, where they will learn more about arthritis as a chronic disease. If you look at here, the legislative position statements, and I just mentioned this earlier, that's in our new handout for the state legislators. This lists all of our different positions, but if you look at biosimilars as an example and you click on that, then you will see the actual position statement. If you scroll all the way down, download and share, this will give you the full document that you can have available to share with your legislators. And this is something that when we do an advocacy day on a state level, that we always share this as a leave behind to explain more about what we do and how we stand on a particular topic. And then if you go over to the, let me see, okay. Track state legislation, and this is going to give you a map where you can hover over whichever state you want. You click on the link at the bottom, and this will bring you to the live map. So if you click on, let's say, Virginia as an example, then that's going to give you what's going on right now in that particular state. The bills, and this is just an example for Virginia, what's occurred so far this year. And then you go back to news and regulatory letters. And, you know, you're always and probably will be asked, I know we are, as to what the Arthritis Foundation is doing on the Hill in D.C. and what we're doing to help people, constituents out in the community, and what we're asking of Congress to support. So to give an example, this victory in Iowa, the biosimilar legislation that was passed, then when you click on that, that will actually take you to our blog, and will give you lots of information. That's a story that we're sharing there. But also it gives you, the blog gives you stories from everyone across the country, but also news and different activities that are going on. So it's important to sign up for the blog. And if you scroll down to the bottom, here you can sign up very easily for the newsletter. And that's all. Thank you. And I'll turn it over to Sandy.
Thanks, Claudia. I know that's a lot of information, but just remember that we're here to help you with any questions that you have, and please use the chat feature and send your questions our way. I want to talk for a minute about prescription for access. I think we're missing part of the slide here, but the reason I wanted to share this with you is because it's an initiative that the Arthritis Foundation has undertaken over the past 6 months. We started in the fall, and we met with, and it was Ann Palmer and one of our board members, and Anna Hyde staffed this event, this activity. And we met with all of the players in the healthcare system. And by that I mean we met with pharmaceutical company executives, we met with hospital executives, we met with folks that run trade associations for the pharmaceutical industry and the bio industry, the hospital industry. And we also held about 100 patient interviews, mostly at the annual meeting last fall, to really start to understand what the patient experience was dealing with the healthcare challenges. And while we know that some of those challenges can be fixed legislatively, and that's a large part of what our state legislative agenda seeks to attack, we also learned that patients need help navigating their coverage. They need to know what kind of records they need to keep so that when their insurer asks a question, they have those in the file cabinet. And we also, as a result of these interviews, developed patient principles for healthcare reform and also legislative patient principles to guide our activity. And we used these at the summit last week to help lobby on behalf of our community for an appropriate healthcare reform bill. We also did a survey of our advocates, and we learned that 4 things were really important to them in a new piece of legislation. One is that 26-year-olds can stay on their parents' insurance. Another is that there be no lifetime caps and that there be no annual caps. And also that pre-existing conditions are not a reason for an insurer to not make insurance available to you. And so those, if you want to click on this when you go on the website, you'll see those are in our patient principles document. And we're very proud that we can really speak for our community. Next slide. In addition, what we learned is that people have trouble appealing claims. They need resources when they get a prescription that's really expensive, and they really don't know what kinds of foundation and copay assistance programs are available from pharmaceutical companies unless their doctor tells them, and we're finding that sometimes their doctor just doesn't tell them. So if you go on our website, you can see that we've really tried to, in a stratified way, make these tools available for anyone that has questions about understanding your coverage, appealing a denied claim, and resources that you can use when you have a denied claim, and then just general options about your coverage. Because what we heard from our 100 interviews was that patients were really drowning in the administrative nightmare, is what we heard, that they're experiencing when things don't go according to plan. So, excuse me, we wanted to make these tools available. And you should also know that we have an 800 number where we have social workers available for people that might have questions, and we can make that 800 number available to you. Next slide. So I'm going to stop there, like I said, and I'm going to turn the program over to Mark. It's been a lot of information, and Julie's going to be reading your questions, and we will be answering them. So there's still an opportunity to type in any questions you might have.
Hey everybody, this is Mark Hyman, the Director of State Legislative Affairs, and I am here to answer any questions you may have about state legislation. We're currently working on about 150 bills in 41 states, so there's a lot going on.
Hi, Mark. This is Julie. I have a number of questions from our group, and I'm wondering if you would be able to answer. Could you clarify all of the things that need to happen in order to accomplish Platinum Ambassador status?
It's kind of out of my jurisdiction. I think Laura Keeble would have that, but all the instructions for achieving Platinum Ambassador status are on the website.
We can clarify just a little bit. There is information on the website that you can find, but it's there are monthly assignments for achieving just ambassador, but to achieve Platinum Ambassador, you do those in addition to 4 bonus assignments and a $1,000 fundraising goal.
Right. And if you are interested in that, please reach out to Laura Keeble, who'll be happy to work with you on that, achieving that goal. And we're hoping to get people signed up by the end of the month. So it's something that you should act on pretty quickly.
Another question we have here is, how is the State Advocacy Committee managed if there is no CED?
You cut out on the how is the state program?
The question is, how is the State Advocacy Committee managed when there is no CED?
Right. Well, each region has a member of the advocacy leadership team. That person is responsible for all of the states in that region. So if there's not a CED, that member of ALD would handle and help out with the coordination of that. They're also really the legislative experts for that particular reason and for the region in those particular states. So they'd be part of the process to guide everybody through what they need to do.
Awesome. This is a question from Carol. What are the expectations and or guidelines set for local EDs relative to advocacy?
There are some general principles set up. It really depends on the state. Some states are more active with their activities and more mature in the process. So it varies by state to state.
But generally speaking, I mean, the EDs and the CEDs do have advocacy on their list of responsibilities. It's just when there aren't those positions available, then the advocacy leadership team member would take on a little bit more of the responsibility.
It's really a partnership at any given time.
Great. And here's one more question. Are there any states aside from Metro DC that are a part of regional advocacy committees instead of state advocacy committees?
Anna's coming over for this one.
So as part of Mark, do you want to take this one?
No, I was just going to say, well, DC is not a state, but that's a secondary issue.
Well, as part of our coming together as one organization, we've been working towards moving away from the regional advocacy committee structure into just state-based committee structures. So to the extent that there's still carryover for either local market or regional advocacy committees, what we would really want to work on throughout 2017 is a phase out of that and just making sure that anyone involved in any regional committees has the opportunity to serve on a state committee or in some other volunteer capacity.
Great. Another question we have is, what is a CED, or what does CED stand for?
Well, CED stands for Community Engagement Director, and it's their responsibility to work with the volunteers in the state. And then the executive director also has responsibilities along those lines, but they're the ones that largely put on the programs that people attend and works on the walk and other activities that have the volunteers involved in the Arthritis Foundation's programs. Good questions.
So there's an expectation that the community engagement director, if you have one, is the person who works with the state advocacy committee. If you do not have one, it could be the alt person or it could be the ED.
That's correct.
Another question we have here is, the 2017 goals shared sound pretty high level. Are there specific goal metrics for each state to try and achieve?
There are some specific metrics. One has to do with an increase in the number of advocates in that state. I think that we centered on a 14% increase in advocates. And also we're going to be looking at engagement of members of Congress in terms of the Arthritis Caucus. We're going to be looking also at the Platinum Ambassadors in each state. You may have heard that we will be hosting the larger summit every other year. And in the off year, we will host a summit in Washington, D.C. for platinum ambassadors. So we want to increase the number of platinum ambassadors so we have a robust meeting in Washington. It'll also be in March. And those are just some of the things. Now, in some states, there may be an opportunity to engage your members of Congress or your state legislators in walks or other fundraising activities. That would certainly be something that we'd be looking at and encouraging. And, you know, there may be an opportunity to, in May, have a proclamation around Arthritis Month. I mean, there's, as Anna said in her talk, we want to make this organic and we want to make it work for you. And so we're hoping that the committees will get together and decide on a work plan, assessing with the CED, the ED, and the ALT member what it is that they can accomplish. And sometimes in this advocacy work, it isn't passing a bill, but rather setting the table in 17 so that you can pass a bill in 18. So we don't want to dictate what your work plan is. We want you, in concert with the professionals on your team, to come up with a work plan. These are all really great questions.
And we do want to engage everybody when we have the opportunity in a state to reach out to their elected officials, to testify, to help out with op-eds. Anytime we have an opportunity, we want everybody to be a part of that opportunity, that work.
Awesome. So do we have any other questions from the group? Okay.
Well, in closing, I just want to say thank you again for your willingness to serve in a leadership role, and we really need your help. And
Sandy, we did get one more question.
oh, okay.
Before we go, it is, are there or will there be opportunities for state advocacy chairs to meet to discuss their experiences?
Good question. Yes. Once we complete the training, which we're hoping that we'll complete in the second quarter of this year, we will definitely be hosting webinars for advocacy chairs to get together and talk about best practices and ideas that they have that they can share with other advocacy chairs. So that is definitely on the agenda. We do want to get everyone trained before we do that. So as soon as we can get the training completed for each of the regions, we'll be setting that meeting up. Also, if you have any specific ideas, you know, shoot them to me or Anna or Mark about things that you think we should be doing as an advocacy chair. We're really open to hearing any of your suggestions. Any other questions? Well, thank you very much. We're going to record the webinar. It will be posted on our website. And this is a pilot project. You are the first group of advocacy chairs to go through this training. So definitely send us feedback if you have any thoughts about what we can do better or what additional items you would like to see. Thank you so much to everyone for participating. I know it's the end of a long day, and I wish you a very good evening. Good night.